Hi, Mike Matthews, physical therapist here with the PT411. Thanks for joining me. Make sure after this video you hit the like button. If you're over on Facebook, head on over to my page there and like that. If you're not already there, head on over to YouTube as well. Hit the subscribe button so you can be notified when I come out with another video. Also, make sure you leave any comments of anything you want me to address in a future video. So last week's video we were talking about manipulations and adjustments. We talked about what people claim they do and what they actually do, and we talked about when they are and when they aren't appropriate. So if you haven't seen that video yet, make sure you head on over to the PT411 page and check that video out. So for today's video, I'm going to show you how to pop your lower back. And we're not talking about a quick manipulation. We're not talking about a quick thrust. We're talking about a nice, slow stretch into that and seeing if we can get a pop, if we can get that cavitation. Even if we don't, we'll still get a good stretch, a good mobilization out of it. But sometimes that pop can give it that little extra. So to do this, we're going to have to lie on your side. I'm going to make sure that I'm staying in frame here. Get a good position here. You're going to make sure this bottom leg stays nice and straight. Your top leg, you're going to bend it. And typically the higher it's bent up to start off with, the higher the level on your back that's going to pop. You're going to take this bottom shoulder and you're going to walk it forward some. So now our back is actually in a flexed position. It's curved forward. Your top shoulder, you're just going to very slowly allow it to go back, to twist that back, and oop, I just got a pop in my back right there. Just let it slowly go further and further out. And to increase this a little bit further, if we're not quite getting it, you can straighten out this top arm back behind you here. That's going to increase that rotation a little bit more. And for some people that are a little bit more flexible, you can take this top leg here and move it straight up over here, get a little bit more rotation in that back. And I just got another pop right there. And for people that are extremely flexible, you're gonna have to do this on the edge of a bed or edge of a table. So you can imagine the edge of the bed being right about here. The rest of my body is up on the bed. But this top leg right here is going off the edge of the bed to get a little bit more of a stretch. And like I said, work into this nice and slow. Don't go quick into it. No quick sudden movements. Just work into it nice and slow. If it's painful, just work into it, into that pain-free zone. Use that top shoulder. Go back nice and slow. And just let off of it. And just slowly try to see if it'll loosen up and let you go further and further back. So you can get to the point where you're nice and relaxed. Work further and further into it. And see if you can get to that pop or not. But like I said, you don't necessarily need that pop to get a good mobilization in your back with this, but definitely sometimes that pop is needed to help get the edge off there. Okay, so that's it. So, a quick video, short and simple. If you're looking for more information on how to maintain a healthy back, head on over to my YouTube channel. I already have several videos up on the subject. My next several videos will also be on this subject. So make sure you hit the subscribe button so you can be notified when I come out with any future videos. Again, I'm Mike Matthews with the PT411. Thanks for joining me.